Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, we're going to get to as many questions as possible. But Dad, I was looking at the list of articles that you have to go through, and I don't know how many questions we're going to have time for.
Yeah, well, I'll just stop. These are the things I just noticed this week. And I was afraid of that too, Heather, is that I had too many things that caught my attention this week. And I'll just save them for next week.
But I mean, that's just 1 week's worth of stuff. So you can just imagine.
So I'm going to try and start out each of these sessions because some people, they've heard the question and answers before. They just like to move on with things that have caught my attention this week. We could title it Update of McDougall's Medicine, a challenge and second opinion, because as you are very sensitive to, some people say, well, he puts in the citations that are 20, 30 years old. Well, excuse me, that's when they did the original experiments. But what I like to show you in the videos I do, and also in the sessions we have on 5 o'clock Pacific time every Sunday evening on YouTube channel, which is what we're doing right now, is I like to show you that the truth don't change. And people are doing articles that are similar, coming up with similar results, 30, 40 years later. It doesn't change. So, the science does deserve that kind of criticism. The earth is still round, folks. It's not flat just because somebody wants to tell you it is. Or they discovered it like 500 years ago. Copernicus or some guy was looking through a telescope. Anyway, I have that history. The things that I noticed that I thought I would like to bring your attention this week is Beyond Meat is going financially bust. Have you ever tried that product? No, you have. Okay, Heather. Well, it doesn't taste anything like we're familiar with. And they really deserve to go broke. And it's no remnants of healthy because they just take a bunch of chemicals and put them together in a Erlenmeyer flask. No, probably not. They put them together in some type of vat and they just spin it around and crush it and heat it and put all kinds of pressure all over it and turn it into something that looks like.
Well, see, it looks the same. That's why I think they were hoping that people would like it.
It doesn't smell the same. And believe me, well, I don't.
Well, we don't know how we don't.
It's been a long time.
Yeah, it's been a long time.
All right. Who won the New York Marathon? Come on now. You guys are paying attention. Who just won a couple weeks ago? 2023 New York Marathons. Let's see. Albert, the names are not going to be good because they're African names. Albert Corey from Kenya. Okay. And let's see. Shura Kitaka. Tamara Toto from Ethiopia. Shura, I'm not even going to do the names. SK from Ethiopia. AK from Kenya. TT from Ethiopia. Now we go on to the women's. HO from Kenya. SL from Kenya. LG from Kenya. Ethiopia.
That's amazing.
They won every single place on corn. You would think that some of the European and Australian and American runners would get the idea that they need to live on starch. 80% of these people's diet from Kenya and Ethiopia is corn.
And I'm sure they didn't change it before they ran the marathon.
Speaking of cultures and everything, this is a special holiday.
Yes.
Diwali.
Diwali.
Okay. And somebody asked me to pay a little attention to that.
The Festival of Lights.
Well, it's kind of an Indian festival.
Yeah.
Mm-hmm. And I was in India about 8 years ago, and I can tell you, it's very modern in their food and in their medicine. You don't want to go there because if you have any money, you'll get sick because you'll eat the food. And you'll be able to afford to go to their expensive hospitals, and they'll finish you off there with American medicine. But the traditional diet of, is dal and bread and rice and corn. That's the diet of the traditional people. And that's what they still should be eating without the oil.
But they're all getting rich now, so they think they have to eat like we do.
Well, 20 years ago, the pronouncement from the British journals was the people who live in India, they have a caste system, and the middle class is as sick as the upper class. And it just happened 20 years ago with the wealth of people that live in the continent of India. Anyway,
Well, I'm sure the poor people are still.
they are, but their quality of food is really terrible, and they're getting a lot of American junk and everything. So, India is a major player in the world, and they're really close to the traditional starch-based diet. I just wish somebody would just take and turn around and see what happened. Look at your parents or your grandparents and decide that you don't need to go that way.
Yeah,
And you
because it
don't
hasn't been that long.
the food. Okay. Anyway, Beyond Meat lost a little bit.
No, that wasn't it. That was the one about Ozempic.
Oh yeah, that's the one. Simple.
Yeah, I wanted to hear about
Oh, you
that.
want to hear? Okay. This one, Nestle is developing products to accompany drugs like Ozempic. Amid fears, they'll eat into food profits. I mean, this has become such a big business that
Yeah, I saw the picture of the candy bar. It said Nestle on it, and it was an ad for Ozempic. It was like, okay.
they're getting their cash registers cleaned by Ozempic because these well, they eat a lot of food. People eat a lot of food, particularly obese people eat a lot of food. They eat more food, more calories. That's how they got that way, more fat. Anyway, they're losing money. I don't know what they're going to do about it, but maybe they'll put out some bad news about Ozempic. Could you find any bad news about Ozempic? Let's see.
You couldn't. What about those articles you sent me about that lady?
Yeah, I did send it. Heather, I gave you that in the chat when I gave you the references. I gave you this story of a woman who for 4 years, well, she almost died. And it took her 4 years to figure out Ozempic was giving her the nausea, vomiting, diarrhea, weight loss, and it ruined her life. Anyway, I put that in the references. Oh, by the way, the articles I'm talking about, I supplied the references that are in the chats for if you want to look it up.
So
Anyway.
this lady that took Ozempic, she got so sick, and she figured for 2 years,
For
2 years she figured she could stand it because she was losing weight, and then it got so bad for the next 2 years that she would vomit all day long, and even after she stopped it, it didn't go away.
But that's what it's supposed to do.
Well, she was,
That somehow or another, the drug company wants you to believe you're not going to get sick when you take Ozempic. Well, if you're not getting sick, then it's not working. Okay, you may not get sick from it, and that's possible, but you're not going to lose weight because that's how it works. It makes you sick. Anyway, speaking of depression,
are you speaking of
I
depression?
think so. Half of the people who take SSRIs, the common antidepressants like Prozac, these SSRIs, half the people have sexual dysfunction. It ruins their sex life. They lose that lack of interest. They stop.
Well, deadens all your feelings. So
It really does. It just changes, well, I don't want to get into any personal issues, but Mary, even if somebody just has like a drink of alcohol, it changes your relationship when you get into sexual relationships. I remember that. So you can't take any drugs. If you want to enjoy the experience of each other, uninhibited,
and life.
and life in general. But I mean, half the people. This is a New York Times article. Half the people suffer sexual side effects. Okay. And then the other article that appeared. Where's this one from? I gave you the reference. Anyways, it talks about seasonal affective disorder, which is one way to treat depression. You shouldn't be, listen, in addition to these SSRIs, when you take them, you get blunted, you get numb. You can't feel the world, much less people close to you. So, you don't want to take these. You want to look for every alternative besides taking these medications. And if you're on them, I have to warn you, don't stop them. They're addicting. You'll have withdrawal. Make sure you're under some type of medical supervision where they know what's going on. They don't tell you something like, oh, just stop the Prozac. You're not going to just stop the Prozac. You're going to be in big trouble, so be careful. But there are other ways to treat depression. And there was an article in the New York Times on seasonal affective disorder. So that'd be a good time to bring it up.
It happens this time of year
That's right, it does.
because it gets dark so early.
And it has to do with the change in the amount of sunlight. And people get relief of depression by the effect of sunshine. And it's to the point where you actually buy lights that have a spectrum that is just like sunlight, and you set them up on your desk and you get an extra light, and so you relieve depression that way. They're called light boxes for seasonal depression. You can look them up. And it's something you might consider doing, rather than being depressed all the time or resorting to SSRIs. The other thing you want to do if you're depressed, and my March 2004 newsletter discusses this. So you want to go into detail. The other things that relieve depression, there's sunshine, okay? In other words, the number of hours a day you get. There's exercise. You know about runner's high, endorphins. You've heard about them, right? Endorphin. I haven't forgot about endorphins.
No.
Okay, so you get the runner's high. You may know about the Wortmans. They worked at MIT back in the 80s. Judith and Richard Wortman. You can look up their work. They found that what you eat determines the amount and kind of neurotransmitters that are in your spinal fluid, which convey whether you're depressed or not, whether you get satisfaction, appetite. In other words,
I didn't know that.
Okay, well, let me go through the details on this one. Tryptophan is an amino acid.
Yeah.
There's a lot of tryptophan in animal foods.
Right.
Okay, so tryptophan turns into serotonin once it gets into the nervous system. Okay, so where you have to go is you start at the dinner table.
Yeah.
You start with foods that have tryptophan. Of course, vegetable foods have it too, but it's really loaded in animal foods. Okay, it goes into the gut. It has to pass from the gut into the bloodstream. And then it has to pass, and it's still tryptophan. Then it has to pass, I have my finger up there. It has to pass through the blood-brain barrier, and it gets converted into serotonin in the nervous system. That's what we call a neurotransmitter.
Yeah.
And that relieves depression. It satisfies appetite. It mutes the world, so everything around you is more tolerable. Anyway, it's the heavy neutral amino acids that are found in animal products that block the movement of tryptophan from the gut into the bloodstream.
Okay.
Because there's all kinds of these heavy neutral amino acids. So when you stop the competing amino acids, the other ones that are at the gate, so to speak, trying to get into the nervous system, you got all these heavy amino acids blocking this gate. It's actually called a blood-brain barrier gate. And so it can't get through because of all these animal foods that are blocking with the tryptophan. Okay, so as a result, or heavy neutral amino acids blocks out tryptophan. So tryptophan, other foods can't get in, can't make serotonin. Anyway.
Well,
what?
I just wonder because I still read articles and I see them, especially about this time of year when people talk about, they get so much tryptophan when they eat turkey
I know, yeah.
that they fall asleep after their turkey dinner.
I didn't say that.
Yeah.
Yeah, but turkey does have a lot of tryptophan.
Oh, okay.
Yeah, but it's sort of vegetable foods. And if you're eating a lot of animal products, then the tryptophan in turkey has to compete at those gates. And it gets blocked out, stays in the gut.
Okay.
All right. So anyways, you've got seasonal affective disorder. You've got exercise. You've got the foods you eat. And you want to look up Wortman's work. They're really, really so extensive. So you've got the foods you eat. And then you've got the most powerful antidepressant there is, which is controlling sleep. You read my March 2004 newsletter, and you can figure out how you can change your mood, like within a day or two, just by controlling the amount of sleep you get. If you sleep too much, you get depressed. You sleep too little, you become manic. So you just find a balance there, and you get the right hour of sleep. What does an average adult need? 6 to 7 hours of sleep a night. Anyway, I thought that was an interesting article. New York Times. This one, Journal of the American Medical Association, and this is from JAMA, November 11, 2023. What they did is they took people and they fed them either a low sodium diet, which was 500 milligrams, or a high sodium diet, which was like it was almost 5,000 milligrams of sodium, and they switched them among these two kinds of diets. And remember, I've told you a diet that has 500 milligrams really will lower your blood pressure. In this case, it lowered to 8 millimeters of mercury, the top number. It didn't lower the bottom number any significant amount, so they didn't talk about that. And it didn't matter whether you were on blood pressure pills or not on blood pressure pills. whatever. I guess what I'm trying to tell people, Mary, which is the message I've been trying to give all along is, look, we like you to have a little bit of salt.
Yeah.
Because the food, and people are afraid to death of having a little salt. Well, when you go from nearly 5,000 milligrams of sodium to 500, you only lower the top number by 8 millimeters of mercury.
It's not much.
Not much. I used to give you, in fact, it's even less than that. That's when you go to the extremes. When you go from normal blood pressure to taking the high sodium diet, you really, I think it's like 4 millimeters of mercury. But the point I'm trying to make is a low sodium diet really doesn't have a major effect on your blood pressure unless you get below 500 milligrams of sodium, which means you add none, zero. You don't have any processed food. You have, no bacon, none of that stuff. And then you can lower the blood pressure, maybe 8 millimeters of mercury. But the real way to low blood pressure is to change your whole diet, open up the cardiovascular system. And that's the way we do it. We get profound drops in blood pressure. Anyway, this is just another article confirming what I've always told you, that low-carb diets don't make a heck of a lot of difference unless you get extreme. All right, we're going to quit here in a second. Probiotics, I've talked about. Prebiotics, thank you. I have you here. Prebiotics, okay, that's enough. We've talked about prebiotics, but it was an article this week in the New York Times. So that's why I brought it up. It came to my attention, things we've been talking about. To tell you, people are still, they're topics of today, of this moment, that we've been talking about for 40 years, because the research was established 60 years ago or 80 years ago. I just happened to be reading it actually I started 47 years ago.
Yeah.
But the truth don't change. Anyway, I'll try and find some more interesting things for you next Sunday. I already got one. I got a really good one here I want to talk to you about. It's about how, they're bragging. I'm going to give you a little hint for next Sunday. And because I'm going to do a little more research on this, I'm really trying to figure it all out, is that, you see, they even claim that these drugs, Ozempic, will help prevent Alzheimer's disease. Something to do with aluminum poisoning. Everything, because losing weight causes all kinds of improvements. The blood pressure comes down, cholesterol comes down, lipoproteins come down, blood sugar comes down. I mean, there are all these improvements when you stop eating. You stop eating the killing kind of food, the animal foods and oils. Guess what? All your risk factors improve, but it's because you stopped eating.
And that's why the people that go through north for water fasts get better. Because they stop eating everything.
And we make people stop eating all the harmful things. So the point being is you're going to see these Ozempic people in the newspaper all the time, GLP-1 agonists, okay? You're going to see them all the time over the next 6 months or a year, bragging about how these drugs, just like they used to talk about how estrogens for postmenopausal women would treat everything. Do you remember that? Alzheimer's and everything else. Is these drug companies, they figure out any way that they can do any bragging that they won't get caught on immediately. Well, I'm telling you, they are caught, because it's not because of any special thing that's going on or some wonderful things that GLP-1 agonists do, Ozempic does, to the body that all of a sudden makes the arteries healthier or the brain smarter or less likely to become demented. This is just a reflection of the weight loss occurs. You get the same results, same cardiovascular benefits. No, it doesn't help Alzheimer's. By like you say, send them out in Alzheimer's place. Stop eating. Wire your teeth together. Go on a low carb diet. Any ways you lose weight. I'm trying to give you some idea of what's going to happen in the near future. Is they're going to be bragging, they don't have the rights to brag.
Well,
but I'm talking about that next time.
Pretty soon you won't even see Ozempic anymore, because now there's a list that I've seen that there's 10 different things, all new ones that are all coming out.
Ones like that. Maybe they'll get a generic one, and then everybody can be on Ozempic, except those people who follow a starch-based diet. Ozempic will never become popular in present day or past Asia. Future Asia, China, Japan, etc., they've got a huge market coming up there because they're all learning the Western diet, and they can become obese just like people in the United States do. It always happens. So maybe they're trying to develop markets.
Probably.
What you do is you go and you sell Kentucky Fried Chicken, McDonald's, and Taco Bell, and then you follow up with the drugs.
Yeah.
They do. I wonder if they consciously think about that. Let's just start a whole market of fast food or the American diet, and then we can push in the blood pressure pills, the statins, the heart surgeries. Oh, this is good.
They might. I wouldn't put anything past them. So
Well, until we have a society that's oriented towards helping people and improving people's health, all we're doing is encouraging sickness. Why? I just showed you. The people at Nestle's are upset because Ozempic's cutting into their profits. They should be glad, but they're not. They're upset. So it's business. Haven't I mentioned it was money before? Heather, go on. Get me before I can get started again.
Okay, you ready? I've got lots
Yeah.
of questions coming in. Here we go. First question. This is from Peter 5.0. He's been asked about someone he knows that's been struggling with Crohn's disease. They've lost a lot of weight, need to gain some weight back, and want to know what your suggestions are in recovering from Crohn's disease.
Well, one approach that might be taken is to feed him calorie supplements like Ensure. In fact, Heather, there's actually, with people with Crohn's disease, there are experiments done, and again, they come from 20, 30 years ago, where they put them on hypoallergenic liquids like Ensure. In other words, they denatured all the proteins. And then they gave another mixture that had milk protein still intact. And by giving, it wasn't Ensure, I don't think it was, but it was a product like that, where again, everything that would cause an allergic reaction, autoimmune reaction, like would occur with Crohn's and the gut wall, everything is chewed up, eaten up in the processing, so it can't cause this allergic reaction. So anyway, they might try Ensure or similar non-allergenic, calorie-dense products to kind of fatten this guy up first. But that's not the way I would approach it. The way I would approach it, because it's only going to be temporary at best, and maybe gain a pound or a half a pound. You know, nothing significant. But the important thing is this person is not going to get well. What they ultimately want, which is their health back, which will result in them gaining the lost weight. When you're sick, you're gonna keep losing the weight. So you've got to deal with the underlying disease process first, and then the weight loss stops and the weight gaining starts because you're healing. You're stopping the sickness. And so that's how I would approach it. Thank you for giving me that opportunity to bring in something I haven't thought about in 20 years. But yeah, that was a treatment used for Crohn's and ulcerative colitis, was to feed them denatured, highly concentrated calorie products like Ensure with lots
so
of
that's
sugar.
kind of like the denatured infant formula you talk about.
We feed babies.
Yeah.
Yeah, it's similar to that, right?
Okay.
And of course, the ultimate denatured diet is a water fast.
You don't gain any weight though.
You got nothing to react to. And that's why in the very difficult, it doesn't happen often, but we send people over to True North who don't, for whatever reason, respond with autoimmune diseases to the basic diet. The basic diet usually handles it. It takes about 4 months. You shouldn't expect it to take any longer than 4 months. It starts. The benefits, not for Crohn's and ulcerative colitis, because that's deep inside the body. You can't really see it. There's a lot of disease on it. The bowel is really thick because it's been going on for decades.
Right.
So it's not like the joints. The joints get a little inflamed and you can see it and you can feel it. And, it's not a lot of swelling and stuff and not a lot of healing to occur. These joints start to move around and feel better.
Yeah.
Whether you have whatever you want to call the autoimmune disease, you want to call it Crohn's. Crohn's patients have arthritis. Arthritis patients have Crohn's. They have eye disease too. The autoimmune diseases go all over the whole body. They're not just one spot. It's just that one spot seems to lead the way. And so you call it rheumatoid arthritis or ulcerative colitis or multiple sclerosis or whatever organ it attacks. But it's the same underlying process. You eat animal foods, you eat an unhealthy diet, you destroy the gut, you let animal proteins in the bloodstream, the body makes antibodies to these foreign proteins, they attack the body.
Well, that's why they sell the same drug for Crohn's disease and plaque psoriasis.
You remember the name of that drug?
Rinvoq.
Rinvoq?
Yeah.
This upsets her terribly.
Well, they advertise for ulcerative colitis or Crohn's disease all the time with Rinvoq. And then they have this other or Skyrizi.
Yeah.
And then they do another ad for plaque psoriasis. And then there's a few of them now that right on the bottom, the very bottom of the screen, there's a little black box that says this drug has not been proved to be of any use in plaque psoriasis. And they advertise it.
Well, maybe the next disease they advertise to, they've gotten approval for that one.
Well, maybe.
These are just immune suppressants. It doesn't matter what part of the body you're talking about, whether you're talking about the eye or the joints or the bowel. These things suppress the immune system. And that's how you get the results. Well, when you suppress the immune system, you can't fight cancer. You can't fight infections. That's why they give you 30 seconds of dancing actors and actresses who tell you how wonderful this drug is. And they spend another 90 seconds telling you how it's going to kill you. And they think when they have their day in court, they'll say, well, I told you so. It's right here. It's in the ad. It's in the literature we put in the box for you, which you never read. Anyway, it's just money.
So one last question about Crohn's
I want to
disease.
say one more thing.
Yeah.
Any of you with autoimmune disease, sorry, Heather, I didn't mean to interrupt. Any with autoimmune diseases, give us 4 months, okay? Then go get on the drugs if that's all you have left. And certainly don't start with Rinvoq. Start with methotrexate or something, so non-steroidal anti-inflammatory drugs. Don't start with the big artillery first, which is what they tell you to do on the TV. There's some
Is there
simple drugs.
anything special that you would have someone with Crohn's disease eat after the 4 months of healing? Is there a special McDougall program or?
Well, Heather, they could always see if they could get sick again. If they were like they said to themselves, because what we go from the basic McDougall diet, no animal products, no added oils. We go gluten-free initially, just to take care of the possibility that they could have a leaky gut, because wheat, barley, and rye can cause a leaky gut in sensitive people. So we start out with that extra additional helpful recommendation to close that gut wall by going on a gluten-free diet. And then we go to the elimination diet, which is described in my May 2014 newsletter. So then we give up and we send you to Alan Goldhammer's place. You say, why don't I go that first? Because when True North lets you out, they're going to put you on the McDougall diet. So go figure. You can go to them. Yeah. Or we can take care of you first. You'll likely succeed, but now we'll send you over to Goldhammer and he can work you over.
Have them eat anything special after they've been eating this for.
No, what I was going to say is they could test it. Let's just say that they thought that they really wanted bread, and they thought that bread was a problem. Well, it'd take about a month to get them in trouble with celiac disease to break down that border. So they have to commit themselves to eating like maybe a half loaf of bread a day. And then they get sick and they go, oh, I
guess I can't eat bread.
I can't eat bread. And it may not take that long. It just could take you 2 or 3 days before you have symptoms. So, but it talks about in my May 2014 newsletter, how you do that. So that's why you might expand the diet afterwards, is you just say, look, and you might find out that you can have a little bit of bread, but then again, you might not, but you have to test it. There's no blood test or skin test or anything they can do to figure this out.
Thank you. Next question. This is from C, and I get this question a lot. So this person is a big salad eater and they're concerned about too many oxalates. What's your take on that?
This is a big concern. It should be for you folks. I actually, and I could name his name, but I'm not going to. I actually can name a specialist in kidney disease who actually gave a presentation within the last probably 4 months on how you shouldn't eat vegetables because they're full of oxalates, which cause calcium oxalate kidney stones. The most common kidney stone on the Western diet is made of calcium and oxalates. Okay, so it's obvious you should eliminate oxalates from your diet, right? Well, oxalates are in plants. What you find worldwide is people who eat plant food-based diets don't have kidney stones. And those who eat few plant foods and lots of animal foods, they're the one that had the kidney stones. So how do you put this together? And by the way, this kidney specialist couldn't and didn't do it. he said that what you do is on somebody who has these kidney stones, and there's some reason to take this attitude. He's not completely wrong. But is that you need to cut back on the vegetables in some people. It's only a very rare person, because most of the oxalates gets into people by this mechanism. Oxalates are tied up in the plants. They don't move. They're stuck right there in the plants. They're not going to get out. Okay, they're in calcium oxalate or some other cation oxalate, and they're stuck and they're insoluble and they stay in the plant. Okay, so you eat it and it goes through your intestinal tract and it's not absorbed. So how do you get the oxalate? Well, if you eat fat, vegetable fat, animal fat, there's a process called saponification. It should be spelled S-O-A-P, because it's like soap, but it's not. It's S-O-P, saponification. And what happens is a soaping process, like you get in the shower. You got hard water with lots of minerals in it. You feel clean afterwards. But if you don't, because it's the minerals that grab a hold of the soap and make it washable. But if you have low mineral water, okay, then what happens is the film of soap stays on your skin. In other words, this doesn't break down and get to be washed off. All right, so you eat fat, vegetable fat, animal fat, and what happens is the calcium oxalate break up, and the soap goes with the calcium, and the oxalate is freed. Now the oxalate can be absorbed. So where do you get a high-fat diet? It's the American diet. It's animal fats. It's vegetable oils. Anyway, that's the mechanism as to how oxalates become troublesome. It's only when you eat fats and oils with them. Otherwise, they stay in the plant. They go out with the doo-doo when you flush the toilet.
So don't put any oil on your salads.
Or in the toilet.
Thank you. Okay, next question. This is from, let's see, Uba Steven. They're pre-diabetic with an A1C of 5.9. They've tried to follow your diet, but noticed that their sugars go up after they eat fruits.
Sugar always goes up after you eat. Supposed to. That's why you eat. I know this surprises a lot of people, but the reason you eat is to take in energy. And the preferred energy is sugar, glycolysis, glucose. So after you eat anything that has glucose in it, there's no glucose in animal foods. There's no glucose in chicken or fish or beef or pork. Zero, none. 2% of the calories in cheese are sugar. 2%, 98% are not, okay? So you're eating a diet with basically no sugar in it when you come to us on a very intense American diet. You're eating all animal foods, cheese and beef and chicken and so on. There's no sugar for the blood sugar to rise. These
So then why are they all diabetic?
Oh, because that made them diabetic at a whole other metabolic level. But we're talking immediately after the meal.
Oh, okay.
We're not talking. That's the right question, but it should be asked in terms of what are you trying to accomplish? Do you want to have the blood sugar low right after you eat, or do you want to have it normal for the rest of your life? If your only goal is to have a blood sugar, say of maybe 140, let's say normal we decide is 100. You don't eat vegetables if you're diabetic or non-diabetic, because your sugar is going to go up to 140. Okay, and in a diabetic it may even go higher because they have less functional insulin. All right, so that's the short-sightedness of people who are dealing with their diabetes. Is they think the object is to make the blood sugar as near normal as possible. That's not the object. The object is to get rid of the diabetes. And how do you get rid of the diabetes? It's 100% curable if it's type 2 diabetes. No doctor will tell you any different. No drug company will tell you any different. If you have real type 2 diabetes, it goes away with weight loss. Wire your teeth together, get locked up in a prison cell, go on a low carb, make yourself sick diet, take Ozempic, doesn't matter. You lose the weight, the diabetes goes away. So getting to the bottom line is the safest, least expensive, long-term way to lose weight permanently is a starch-based diet. Everything else is temporary. and it makes you more ill overall. Like, for example, low carb diets. People don't stay on that. Atkins didn't even stay on that diet. When we caught him, he was like 60 pounds overweight, but we'll get to that story later. Anyway, let's put things in perspective. You want your health back. And any foods that have sugar in it are going to raise your blood sugar. Animal foods are not going to raise your blood sugar. There's no sugar in them. So the glycemic index you got it. And we do. Our diabetics, well, I tell you, Heather, you must be still reeling from the last program, because we had an awful lot of people with that. We had a lady, I'll never forget this. She was upset with me day one because her blood sugar went up when she went on the McDougall diet day one. And during the introduction we do when we have people come in, we do this get to know you type thing, because all of our people get to know each other who are in a program. So we did a get to know you thing. And she told me, she says, this is not right for me. I feel terrible. And my blood sugar went really high after I had the first meal. And I had to give her the whole speech. You stick with us for 12 days and you'll be talking completely different. At the end of 12 days, she was off all her insulin, all her diabetic pills, normal blood sugar, with hope. She had probably 100, 150 pounds of weight to lose, but she could at least see there is an opportunity to get well. And she got over the nonsense. Took her a few days, the nonsense of, well, I can't eat this, maybe my blood sugar will go up. Excuse me, I can't eat this because it makes me sick. I can eat this because it makes me well. And yes, my blood sugar will go up a little bit for a little while. My blood sugar goes up when I eat. Her blood sugar goes up when she eats. Heather's blood sugar goes, so will you as a diabetic. And it may go a little bit higher than, say, this and Heather and I, because we have a functioning insulin
Well,
system.
we don't test our blood sugars all the time either.
When's the last time you checked your blood sugar?
I can't even remember.
Every time we have has been, in laboratory. We don't check our sugars.
Thank you for answering that. I get that question all the time. So it's important.
I think we want to answer it is just say, what is your goal? Try and explain to them. And if their goal is to have lower blood sugar in a half an hour, well, I don't know. That's not what we're about. We're about getting you well so that you don't have to take any insulin, any diabetic pills. You're trim, you're healthy. Your risk of heart disease is pretty darn low. Risk of cancers, well, hopefully that's a bit low too. But you've been eating a bad diet for a long time. So those things add up. Time to change.
Thank you. Next question. This is from Liz from Liz. Can a starch-based diet reverse kidney disease in a child?
Yeah, I actually show Kempner's little 11-year-old girl in the slide presentation I always give on Walter Kempner from Duke University. And he has this 11-year-old child who has nephrotic syndrome, who's laying in her bed, swollen, obviously very sick. And then you have a picture of her several, maybe weeks later, not very long later. And she's laying in bed, she's trim, big smile on her face, basically cured from nephrotic syndrome. She's 11. Yeah, absolutely. The children should be put on this kind of diet because you have a chance of slowing or stopping, maybe a little bit reversing, maybe not, but slow or stop the failing of the kidneys to at least keep them as long as possible healthy. You will not be disappointed. You feed an adult or a child with kidney disease a starch-based diet, precautions about beans, peas, and lentils, with extreme kidney failure, cautions about potassium. You feed them this kind of diet, you will see overnight changes, benefits. Depending on how much kidney was lost, how much damage there is, depends on how much improvement you can get. But you will show improvement without any adverse effects or basically any costs. Why not?
Thank you. Next question. This is from Doug. He's wondering if you have an opinion on trazodone as a sleep aid.
Only a little bit, Heather, because it's one of those drugs that I don't know too much about, but I have seen people become dependent on it. So I worry, these sleeping pills could destroy your life. And so trazodone, I would look up all the precautions, and I think you'll find that it's addicting, and you go through withdrawal when you stop it. And I don't think it's a very good pain pill, anyways.
Oh, they were talking about sleeping.
I don't think it's not.
It's not, that's not what it's prescribed for. Usually it's,
Well, people take it for pain.
oh, okay.
So
Anyway,
what would
so
you
I-
recommend for a good night's sleep?
Don't sleep. Heather, I have been trouble with sleep since I've been 5 years old. So I actually remember 5 years old, being awake all night and having it bother me terribly. So my whole life has been dealing with sleep issues, and some places I've gone have not been a very good idea. But the place I am now and have been for an awful long time is I've figured out if I get more than 7 hours of sleep at night, I don't sleep the next night. I'm too wide awake. But if I get 6 or less hours, I sleep really good. Last night I got 4 hours sleep. I'll really do good tonight. And I haven't had a nap all day. And I'm still awake. But that's what I found, is that's what helps. I don't know of any, they talk about valerian root. Maybe in somebody who's really sensitive to herbs, valerian root would be of value. I suppose people try marijuana for sleep.
Yeah,
I would think so.
some people do. Yeah.
But you want to stay away from the benzodiazepams, like Ambien. They have reevaluated that drug over the last 5 years, and it's gone from it's perfectly safe. You'll never get addicted to it. This is one of the worst drugs there is in terms of addiction. You'll suffer more trying to get off this drug than any other drug, including opiates. So you want to stay away from anything like the typical sleeping pills. There are a whole bunch of them out there. They go by different names, but they're all benzos, benzo, benzodiazepams. Stay away from those at all costs. If you get hooked and you're hooked now, don't try and stop them without some professional help.
Thank you. Okay, next question. What are your thoughts on taking 5 milligrams of DHEA to help with lethargy related to menopause?
I have no evidence to say it would work. DHEA is a male type hormone that both women and men have in their bodies, and it's sold as a supplement, but it's mostly sold in terms of male health. It's supposed to have some testosterone, libido type effects, but I've not been impressed with how effective it is at either improving people's sex drive or strength or weakness. I haven't been. Now, have I looked up the studies on it? No, I haven't. But that'd be something to be interested in. But you know how I feel about supplements. So to quiz me about supplements, you're probably going to get a similar answer a lot of the time. I don't know anything about it because that ain't my field. In fact, pretty much every time it becomes my field, I look it up. I can come to the same conclusion: expensive, useless, relatively non-toxic. Wrong. The thing that bothers me most about taking supplements is it takes people's mind away from what they should be focusing on, which is the food. Oh, I'll take this multivitamin. I don't have to give up my fried chicken. Just it's got fried chicken vitamins in it. I know it's going to be okay. No, these things are useless and dangerous. Stay away from them. Now, supplements in terms of DHEA are different than mineral and vitamin supplements. So I'm sorry I confused you there a little bit. It's more of a hormone type thing. It's more of a natural drug as opposed to vitamin C or vitamin E. So I kind of mixed up the categories there. But it still has adverse effects, and the positive effects are few.
Thank you. Next question. This is from Patrick, and he wants to know what your thoughts are on an enlarged prostate and what can be done to help.
Well, that's an interesting one. Well, first of all, you know what I believe in terms of food. There are some populations of people, the population I think of right now in Greece, that was studied that had a very low incidence of benign prostatic hyperplasia, BPH, benign prostatic hyperplasia, or prostate trouble, or prostatism, or whatever you want to call it. The problem is when as men get older, their prostate gland enlarges, and enlarges as a consequence of the Western diet, I believe. But that, I ate the Western diet for almost 30 years, and so did you. So a lot of inflammation and scar tissue was laid down, prior to us getting wisdom. Anyway, you always want to eat a good diet. That's important as far as relieving it. There's an article in our website. You look under hot topics, benign prostatic hyperplasia. It's under hot topics, diseases, benign prostatic hyperplasia. And what it does is it tells you, first of all, you start with simple hygienic measures, like just don't drink water or any beverage before you go to bed at night. You reduce your volume intake as much as possible, so you have to get up as infrequently as possible. Coffee, terrible as far as frequent urination and urgency and leaking and dribbling. Coffee, decaf coffee too, not just regular coffee. So take care of those measures. The next step would be to try some of these supplements, like saw palmetto, that's a big one, or stilbestrol is another one. There are different supplements that have activity on the prostate where it's supposed to make it easier to hold your urine and to urinate. They sell a lot of them, but I think that's not because they work. I think it's because there are a lot of men who have trouble. We're in a market right now where the bulk of the market is people who are in their 50s, 60s, 70s, and 80s. That's our age group. That's who they're marketing to. That's why they're marketing these Alzheimer's drugs or supplements or dementia supplements. That's why prostate become heavily advertised. What else do they advertise to old people?
Oh, well, Prevagen.
Well, that would be a dementia drug.
Oh,
yeah.
Well,
any of the stuff. How about the fruits and vegetables that are coming?
Nature's something. I don't know. They're just crumbled up fruits and vegetables.
Crumbled up fruits and vegetables. They're marketing those to older people now too. You notice they don't have kids or teenagers or even midlife adults on these advertisements. You got people who look like Mary and I. Anyway,
we're rolling around in the grass and having fun.
So this article, which is on my website on hyperplasia, goes on after the herbals, and it mentions the herbals for you, and then it goes on and talks to you about minimal surgeries, and they would be like transurethral microwave thermal therapy.
Yeah.
Yes. TUMT, transurethral microwave thermal therapy, heat treatment. There
aren't very many places that do that.
I can't really. I've looked around for those and haven't found any. And so they have laser treatments that you can find pretty frequently. They have this thing that they put in this little clip. I don't know what that's called.
No. What did my dad have done?
Well, back then they used the TUMT.
Oh, the microwave thing. Okay.
Great results. He got.
Yeah, I know he did.
6 more years. Oh, I know. There's another set of drugs that's used, which are Proscar. They're anti-testosterone drugs, which shrink the prostate a little bit, and I would give those a try. And then there's another set of doctor-prescribed drugs. This is all in the newsletter now, so don't worry about writing it down. These are alpha-adrenergic blockers. They're originally used as blood pressure pills. They're supposed to relax the prostate. They're called Flomax. Well, that's one of them, Flomax. They're alpha-adrenergic. And then you go on to minimal surgeries. We started with transurethral microwave thermal therapy. Laser is another one. They also do, they've got a new one out now. I don't know. But they put this little something or other up near your bladder, and I think they can take it out once it's in. I haven't learned much about that. Anyway, there are some other techniques that people try. As far as I'm concerned, all of them need to be tested before unleashed on the public. And then there's radical prostatectomy. Remember, I was a surgical nurse. I've worked in hospitals for most of my career. I'd walk into a man's room. He'd be laying there in the bed with a catheter up his bladder with a bag at the end of the catheter full of blood. And he had to lay there for like a week because the bulb of the catheter pulled up against the area where the surgeon radically removed his prostate. So they couldn't let him go from the hospital until he stopped bleeding. This is radical. You never have an erection again. And then they also take them out from the top. They used to anyways. This is one where you go through your urethra. I would delay any type of treatment except for the herbs and maybe the doctor prescribed drugs, which I don't think work. For as long as you can. And do those things we talked about, water restriction, and try the herbs. But before you go on to surgery,
I guess getting old is not easy.
well, yeah, except it all stops.
The alternative is worse, right?
That's right. The alternative is worse.
All your troubles will be gone soon.
Well, I just have to realize that, in myself, I'm not going to be 30 again.
I know it's,
no matter what I do.
And the problem is that we feel like we're 30. Except we don't function like we're 30. I'm playing. Jason and I are learning how to play chess together. Her son, Heather's son. So we're playing chess. Well, I almost beat him this morning, but he's only 19. I'm going to beat that kid because I'm practicing for the 3 weeks he's going to be gone. But anyway, the brain hasn't stopped working, but it's not very good against a 19-year-old who's pretty good at chess.
He just has to read one chapter and he's got the thing down.
He's really smart. The kid is a college student who studies all day long, who's just brilliant. And you expect an elderly, what did I call myself yesterday?
I don't know. I must have missed it. Elderly is good enough.
I don't know. Something about losing my faculties.
Okay.
I know. Never mind. I'll think about it later.
You do just fine.
Anyway, all I can say is I'm still getting old. The other problem. Never mind. When I think about it. What do you got, Heather?
All right, let's see. Next question. Lots of questions coming in. Okay. This is from Margaret. She's wondering if eating the McDougall way will prevent flare-ups from lymphotic colitis. Lymphocytic colitis.
I think so. What you're talking about is you're talking about inflammation of the bowel, which is similar to Crohn's or ulcerative colitis. It's an autoimmune type reaction, and you just have a lot of mucus with a lot of lymphocytes in it. And it's inflammation of the bowel, and that's why they came out with the name. I don't know that there's anything special for it, but just stop and think for a minute. Is what you put in your intestinal tract has to influence its health or sickness. At the very least, the diarrhea will stop. I've talked to you about this, how Andreessen published his studies in the early 1970s. Look it up, Andressen. Andreessen published his studies in gut in the early 70s. And he found that if you take people on the typical Western diet, you take the fat out of their diet, who have Crohn's disease. People who really had Crohn's disease, just like this person is likely to have something similar. They would put them on a low-fat diet like ours, and they'd go from 20 watery, explosive stools a day to 2 or 3 form stools in 48 to 72 hours, just by taking the fat out, because you reduce the amount of bile acids. So you're going to get better right away. Then you have to wait for the period of time to heal that inflamed gut. I don't know how inflamed it is. Maybe it's just the surface, and so we call that a colitis. Or maybe it's indurated. It involves the muscles and the underlying tissues and so on in the bowel. So let's just call that ulcerative colitis or Crohn's. Or why don't we call them all irritable bowel syndrome? Then I don't have to remember 3 names. I just call
They're all the same.
They're all the same. Basically, they're inflammatory autoimmune reactions to the food you eat. So start with a good diet, see if you don't get well. My prediction is that you ought to see some signs of improvement in less than a week. Less than a week. Come on now. Just, talk to your doctor, talk to your general doctor and say, I want to do this stuff. I want to eat a starch-based, no added oil diet for just a week, doc. Let's see if it works. My bet is you'll come back into the doctor's office in a week and you'll give a report. Doctor will say, that's great. Whatever you're doing, keep doing it. Next. That's the way they respond to my patients. I'll have patients going with inflammatory arthritis who have been dealing with for decades. And a person will walk in and shake their hand and say, or do a little dance on the way in the office. They'll say, well, you're obviously feeling better. Well, doc, you want to hear what I'm doing? No, I really don't. But whatever you're doing, keep doing it. Next. As long as next keep coming in. And the money comes in
Here's
the
the
other
point where I
door.
jump in and tell you about the doctors that are great and the ones that do want to
Thank
know
you.
more.
Thank
That's
you, Heather.
right.
And there really are. There are a lot of doctors.
We have a lot of them.
Yeah, where are they at?
Oh my goodness. I was just at the
they were-
American
they were
College
all
of Lifestyle
great.
Medicine event, and there were 1,000. So they're out there.
Thousands of them there.
Yeah, she had to go all the way to Denver to see him, and I had to go all the way to Palm Springs to see my 300.
They're out there.
There's-
They're around.
They're spread out around the country.
But the thing is we're going to turn them all on. The Plantation Society, the American College of Lifestyle Medicine, and the McDougalls are going to change the way people practice medicine.
I hope so.
We will. Look what we've done since 1974. Mary and I were involved in the founding, the development of the organization of the American College of Lifestyle Medicine back in 2004. And they got in some financial trouble, and Mary and I kept them alive financially for a while. And they remember that. So we had a lot
And
to
now there's a lot of,
5,000.
there were only a few hundred members then. Now there's,
We probably had a
thousands.
room of less than 50 people when we started.
yeah.
But anyway, we have an organization of well over 5,000 people. And as Heather keeps reminding me, and she needs to, these doctors all want to learn how to cure their patients. They're tired of managing them.
Well, she met a lot of them last week, so.
And it's growing, it's growing because most of them, a good share of my colleagues, I wouldn't say most, are dissatisfied with the results they're getting with their patients. How can you look at failure after failure after failure and be happy? Okay, Heather, I've got 3 minutes.
Okay, lots of questions. We'll never get to them all. Okay,
next
this
one.
one,
Let's do this next week then.
and every Sunday after that. Okay,
Yeah, every
this is from Jim. He wants to know if the ongoing use of topical retin A for sun damage causes any damage to the liver.
Wow. Well, there's a drug called Accutane, which is a retinoic acid derivative, which is used to treat acne in kids, which could cause birth defects and liver damage and all kinds of problems. Retinoic acid, vitamin A, is such a low concentration and not the same chemical structure as Accutane. So I have no reason to believe it would be hard on the liver or cause any reproductive problems, which the Accutane does. Again, why don't you get the kids to change their diet first before they put them on a drug that may make it impossible to have families in the future? Why do you do that?
That's all they know.
Acne is caused by eating the Western diet, and susceptible people, they get a whole bunch of food on their skin. It's called oil. And these bacteria come eat the oil. They grow little pimples, and they grow big pimples. And you get big scars. And you never needed to have that done if you ate a healthy diet, because acne does not occur in populations of people who eat a starch-based diet. I have the research, and I still have it. And you can find it on my website. All right, one more question, Kevin.
Okay, lots of questions coming in about type 1 diabetes. Can this diet help with that?
Yes, it can keep you alive. It will not get you off insulin. You'll have to take insulin the rest of your life. The only type 1 diabetics I've seen, 50 years after diagnosis, with every part of their body working, their eyes, their kidneys, everything, were a couple of patients I saw who were taken care of by Walter Kempner with the rice diet. Otherwise, within 20 years, 17 years actually, most diabetics are either dead or suffered a major complication within 17 years, type 1 or type 2. So, this is a disease that will get you with a whole bunch of complications. You lose your eyes, you lose your kidneys, you lose your sexual function. you can get rid of the disease. That's better. So the last thing I was going to say, Heather, is we're going to make Sunday evening full of information. We have a couple other courses that Mary and I, Heather, attend. We have anybody who's been through our 12-day program, they're patients for life. And we meet with them every 2 weeks now, and pretty soon we're going to change the schedule. But we meet with them every 2 weeks to answer their ongoing medical problems. These are patients. They've been through either the 12-day or the 10-day or the 12-day telemedicine program. We offer them medical advice. Right now, it looks like for a lifetime. It's supposed to be over for only a year. And then we have a START certification course people who actually take a course and they learn how to be instructors to teach the START solution. And in those meetings, which we get together with them once a month, those meetings, and you can join any of these things, by the way, it's not an exclusive club, it's available to you. These meetings are about education to help their patients. And then we have these 5 o'clock Sunday night meetings, which we're going to try and emphasize, at least for the first 15, 20 minutes, new things Dr. McDougall came across. Not new discoveries, but new awakenings from the old times. Anyway.
Thank you. I know people are appreciating the new format, so.
No, we'll keep doing it. And any suggestions you have, please let us know, because we really want to build the.
Yeah, we love to hear from you. You can always email us at office@drmcdougall.com.
All right, see you next Sunday night, folks.
Okay, that was a great hour. Thank you all for tuning in. Thanks, Mom and Dad, Dr. McDougall and Mary. See you all next Sunday at 5 p.m. Pacific.